Welcome to our webinar series for professionals.
Welcome everyone to this webinar with Dr. Tom Fabian, who's we've had him on the webinars before, and it's always a success when he's hanging out with us and we learn a lot. And he's going to cover the GI map test in regards to health in infants and children. So we thought that was kind of like needed a topic and a focus, because we have a lot of kids with gut issues, and why not visit that area in regards to education. Tom is has Greer with her on the presentation. So Greer is a clinical dietitian, and she's going to cover 1/3 of the presentation, and Tom's going to cover the other 2/3. And at the end, we will do Q&As. And actually, after the Q&As, I'll just hang on with some of you and show you some functions in Nordic VMS. So for those of you who want to just hang on, you just hang on. And for those of you who don't want to get involved, you just run off and do your daily duties or enjoy your evening or whatever. But as usual, I'm Anne-Catherine, co-founder of Nordic Laboratories and DNA Life, and I'm all excited about education and supporting you all in learning more in regards to lab tests and supplements. And what Tom is and Greer are gonna talk about today is, of course, the GI map and GI map with Sonulin. And those two tests you can find in your virtual management system, VMS account, if you can't reach out. And of course, we will support you as much as we can. And also in the VMS, you can find different supplements, etc. So you can look into that as well. But I'll cover that at the end. But for now, I will pass on the stage to Tom, and he will delve into the GI map for the first part, and then Greer will take on after that, and then I will meet up for Q&As at the end. So, good. You are ahead of the game.
All right. Well, thank you so much, Anne-Catherine, for inviting us back today. Always a pleasure, and thank you everyone for taking time out of your day to join us here. So we are going to focus today on the microbiome in children, infants and children. I'm going to cover a little bit of the background, the science, kind of the latest science on microbiome in infants, how it develops, some of the key factors that influence the early development of the microbiome, and just some sort of key patterns, key things that you want to look for in a healthy versus less healthy scenario. And then a little bit of the research on how that relates to various conditions. I'm going to focus especially on atopic or allergic type conditions, so food sensitivities in particular. I will have a kind of a brief case example. And then about 2/3 of the way through, I'm going to hand it over to Greer, who we're fortunate to have with us today, who does work more directly with kids. My exposure is more indirect by working with practitioners through Diagnostic Solutions Lab, and I've covered with them, reviewed many cases for children. I don't work directly with children though, whereas Greer does. So we're fortunate to have her here today, so she can answer your more practical questions about ways that she typically approaches addressing imbalances on GI map. So that's what we're going to focus on today. Let's go ahead and just dive right in here. So here's just kind of a screen of some summary points about microbiome development. We're going to get into some detail here. So we do know from lots of research now that the microbiome undergoes progressive development from birth. That's really when the microbiome sort of first starts in infants, up to about age 3. It's going to be variable. We'll talk about that a bit. It's not a completely set pattern in every child that's the same. There is some variability, and some of that is normal. So sometimes you have to recognize when it's really getting off track and when it's just maybe a little bit behind, but pretty easy to recover. So we'll talk a little bit about that. Certainly birth mode, vaginal versus C-section, is known to be very important. Early feeding so formula versus breastfeeding in particular. Environmental microbial exposures, those are really important in shaping the microbiome early on, especially from family members, anyone whom the infant has close contact with. Certainly the introduction of solid foods around age 6 months, so the weaning process can be very important for achieving more of an adult-like microbiome. We'll get into some details there as well. So that's certainly important, an important period in terms of the foods that the infant is exposed to. Interestingly, the microbiome is mostly adult-like by age 3. And this is kind of a rough sort of trajectory. So some kids reach that sooner by age 2. Others may not quite get there until, say, age 5 or so. So there's some variability. But on average, about age 3 is when you really start to see it look much more adult-like. And there's still some development that occurs, kind of minor development. We get some additional species that can colonize, even at later ages. Key influencing factors, there's quite a few, but sort of the top ones, excuse me, tend to be, of course, maternal health. That's really important, particularly in shaping the mother's microbiome. And of course, the infant receives a fairly large proportion of the microbiome from the mother. So the mother's microbiome is very important. Also, timing of birth. So premature birth, of course, can have a big influence. We talked about birth mode and then the additional exposures. So definitely some important factors there. Early feeding details can be very important. It's also the weaning timing and the details as well. And then, of course, there are various disruptors. So we certainly know infections and early antibiotic exposure, poor diet. And that can be a bit of a catch-22 because kids who are very picky, kids with autism oftentimes are very limited on the types of foods that they're willing to consume. So that can sometimes, of course, affect the development of the microbiome. And Greer can speak more to that than I can in terms of experience. But certainly diet, as always, is very important. So I just want to highlight this research review article, which I'm going to focus on for a little bit here because it's very recent. This was published just last year. It's kind of the what's known, the state of the art of what's known in terms of development of the microbiome, and especially how that interacts with our immune system. So we know our immune system is developing at these early ages as well. And there's so much interaction between the microbiome and the immune system, and they influence one another. So that's a really key period to make sure that, if at all possible, we're getting children off to a good start in terms of their immune development by influencing the microbiome. So just a quote here that the diet, environment, and medical interventions experienced by an infant determine the establishment and progression of the intestinal microbiome, which interacts with and trains the immune system. And then several chronic immune-mediated diseases, such as various allergies, even autoimmune conditions, have been linked to altered gut microbiota during this period. So a really critical period for influencing the development of the immune system. I really like this figure because it's kind of like a nice summary of some of the major factors that change in the microbiome from birth through 6 months and beyond. So you can see that down here at the bottom in terms of birth, 3 months, and 6 months. You'll notice this little peak here in the upper left of the screen. And if you look at the key to the right, that's the red line, and that's called proteobacteria. So these are generally what we consider opportunists that can be inflammatory. It's actually perfectly normal when kids are born for these opportunists to kind of take advantage initially. And that's actually not considered a problem in those first few weeks of life. Because typically in a healthy gut, bifidobacterium takes over, and so that's the next thing that happens here. As we get an increase in bifidobacterium, that starts to suppress these other bacteria. So that's kind of the first key transition. That does depend on the quality of either the formula or breast milk. We know that in breast milk, there's specific fermentable carbohydrates called human milk oligosaccharides, or HMO for short, and some other factors, but those are the key ones that help support bifidobacterium. So it's important to make sure that that's happening at that age, that bifidobacterium is typically the predominant species for several months, but particularly and that's again supported by these HMOs, but particularly around the time of weaning, with the introduction of solid foods, and ideally those solid foods do include fermentable carbohydrates that are needed for the beneficial bacteria in this group called the Clostridia to take over and kind of dominate. Those are your main short-chain fatty acid producers, especially butyrate is in that group. And again, another critical period for development of the microbiome and for influencing the immune system and helping to promote immune tolerance so that infants don't start to overreact to foods or even in self-antigens in autoimmune conditions. So pretty critical period here around that 6-month time frame with the introduction of foods. So just a couple more quotes here. So this is just sort of underscoring what I just talked about, that the peak of bifidobacterium and the bloom of Clostridia, which is a major group in the Firmicutes phylum. So on GMAP, we do have Firmicutes. We do have a couple of the key Clostridia. So I'm going to point out which ones we're talking about here. Those are considered hallmarks of a healthy gut microbiome. So not very many practitioners run GMAP on infants that are less than a year old, but a number of them do. I've seen quite a few. And there are some infants that do start to show this Clostridia group, which we'll see on GMAP shortly. Those start to increase in healthy infants, but oftentimes that can be delayed, and sometimes it doesn't develop even through ages 3 or age 5. You'll still see some kids that just still have not really seen a bloom yet in these Clostridia. So that's kind of a key group to focus on. These are your butyrate producers in the Firmicutes phylum. So again, they're prominent. They become prominent at weaning with the introduction of solid foods, especially containing fermentable carbs, and they're the main source of short-chain fatty acids. And they mentioned here that those short-chain fatty acids act directly on T cells to induce what are called T regulatory cells. Those are your anti-inflammatory immune cells, the key ones, that also help promote immune tolerance. So they help basically prevent overreactivity of the immune system. So again, really important to make sure that this group is looking healthy and that you're doing things to promote them in kids of pretty much any age if they're deficient. So this is just kind of adding the immune component here. We know bifidobacterium in that early phase produces various factors, including some short-chain fatty acids, that promote those Treg cells and also help block some of the more inflammatory cells. So that's a very key period early on in making sure that those bacteria are doing well. And then later on, again, the Clostridia produce short-chain fatty acids, especially butyrate, that continue to promote these immune tolerance type cells. All right, so just one more quote from this review article here. We certainly know there are a lot of disruptors. We talked about a few of the top ones, including infections. Antibiotics, unfortunately, are needed sometimes. So knowing ways to help the microbiome recover from antibiotics can be important, which of course includes, depending on timing, if the infant's already starting to consume solid foods, then just making sure there's a good amount of fermentable carbohydrates, i.e. fiber, could be helpful. Butyrate supplementation may be helpful. But we definitely know that antibiotic exposure is one of the major causes of disruption at early ages. So instead of getting this bloom in bifidobacteria, they can often be replaced by these proteobacteria that are more inflammatory. And we'll see examples of those on GMAP shortly. So I just want to highlight a kind of a quick example here. This isn't a full case. But in this particular patient that we're going to show results from, this was a 6-month-old male who had several types of skin conditions, severe eczema or atopic dermatitis, as well as infant acne and something called cradle cap. So definitely some skin issues going on here, which often are connected to gut imbalances, as well as some reflux. That's actually not that uncommon in infants. So at 6 months, this is really when we're expecting to see this increase in the key Clostridia. So we want to see, since this patient is right at that juncture, is that starting to happen for this patient or not? And then, of course, there's the proteobacteria, which should be much lower at that point in time. So that's really what we're looking for at this age. On GMAP, that's mostly in the commensal section. So we see the bifidobacteria here, which for this infant actually looks pretty good. The key Clostridia species, the butyrate producers on GMAP, are Faecalibacterium and Roseburia. Unfortunately, we can see here for this child that there's no detectable Faecalibacterium yet, and Roseburia is very low. So this could be a contributing factor. It's possible that this infant is just a little bit delayed. There's certainly plenty of time to try to get those to recover, but that's a sign that maybe this infant does need some additional focus here on supporting those bacteria. At the same time, we can see that the Escherichia, that's E. coli, which is a normal bacterium, but when it's high, it can be a sign of potential inflammation. But that's in the proteobacteria group that we talked about. And you can see here it's quite high. We don't see it in the E10 range that often. So this is kind of the classic imbalance that you would expect to see in many infants that have a variety of issues at this age. So again, it's very fortunate that the parent decided to do gut testing so we can see what's going on, and there's a window here to intervene and try to correct some of these imbalances. This is also on the next page, on the opportunist page, page 3, for that same infant. We can see here in the inflammatory section, many of these are also proteobacteria. Overgrowth of Klebsiella is unfortunately fairly common in infants, and it does seem to be linked to a variety of infant and child-related conditions. I read a paper a while ago that's even linked to colic, for example, but also certainly lots of other conditions. This is just kind of another paper that underscores that the increase in Klebsiella reduction in bifido early in life often correlates with things like pediatric allergy. So that's one of the key things to look for, is excessive levels of these opportunistic bacteria. All right, so this looks a little bit complicated here. This is back to that review article that I highlighted, but it's a nice summary of kind of generally what happens when things are disrupted early on. So I've highlighted here to the far left, upper left, it says before 6 months of age, there's a list of some of the key disruptors there, including antibiotics. That can lead to this increase in proteobacteria, the loss of the bifidobacteria peak. And then after 6 months of age, so basically when weaning should be underway, there's this loss of Clostridia and the short-chain fatty acids. So again, on GMAP, that's Faecalibacterium and Roseburia primarily. But even if you see a decrease at the Firmicutes level, that can tell you that these Clostridia may be deficient. As far as immune effects, these are your more pro-inflammatory cells. Those tend to increase when those microbes are imbalanced. You'll see the Th17, that tends to be more autoimmunity. The Th2 tends to be more allergic. Those tend to increase. Unfortunately, then these other ones decrease. Th1 is more the types of cells that fight off infections, so kids may be more susceptible to infections. The Tregs are the cells that help suppress overactivity of immune cells. So those are the ones that promote immune tolerance, to help protect against allergies and also autoimmunity. So it's, again, a little bit of a busy figure here, but nicely summarizes many of these key events that can happen with the microbiome and the immune system when things are out of balance. So I'm going to kind of quickly go through a few examples here. We just generally know that, I'm not going to go into this paper at all, but just from the title, you can see here that delayed gut microbiota development or maturation in the first year of life is a hallmark of allergic disease. So that's kind of what we're looking for in patients that are very young, a year or less. This is just a little bit on autism and attention deficit hyperactivity disorder and some of the key findings. This is a review article. So they say here, decreased firmicutes and increased Bacteroidetes were observed in the gut microbiota of individuals with autism spectrum disorder and ADHD. So that's kind of a key imbalance to look for. Again, those firmicutes are primarily the ones that have short-chain fatty acids. Hyperactivity and impulsivity were negatively correlated with Faecalibacterium, and then positively correlated with the Bacteroides, which is the main group in the Bacteroidetes phylum. So again, just some key imbalances to consider in patients that may have these conditions. We also know that this can start, of course, prenatally if the mother is not consuming an adequately healthy diet. So studies, these are mostly done in animal models, but basically fiber deprivation is known to alter the microbiome, not only in the mother, but also in the offspring. So just, again, emphasizing that mother's health can be very important for the infant. I think we're all pretty well aware of that, but this is really kind of illustrating just how important that is. That can lead to this low-grade inflammation and may even predispose to obesity. We also know that healthy diet in the mother also leads to an increase in short-chain fatty acids in breast milk, including butyrate. So early on, before the microbiome has very many butyrate producers in the infants, they're getting some of this key butyrate, ideally from the mother. So very important to consider, again, the mother's health. Again, this is just kind of summarizing that we know about this trajectory and continue past age 3 with adding some additional diversity to the microbiome. I just want to emphasize this here. So this is kind of letting us know that we don't have to worry excessively if it doesn't look like the infant or the child is developing quite on track with the average. We know that they can catch up. So it says here that the gut microbiota of children mature along similar trajectories in general, but at different speeds. So there is plenty of room for improvement, and not necessarily need to over worry that this is, if they're not quite on track, they can recover. And they actually noted in that third bullet point, the effect of C-section on the gut microbiota is actually normalized in most kids by ages 3 to 5. So even that is not kind of a permanent issue. It can be for some patients if they're not getting good support early on, but the C-section itself can potentially, those effects can be mitigated or reduced by age 3 to 5. And that we know it's still developing over time. So of course, diet and promoting health all along can be very important for continuing to support the microbiome. So just a summary of these key points: that, of course, prenatal health, that 0 to 6 months period with bifidobacteria dominating, and then the weaning with the Clostridia, the short-chain fatty acid producers. Those are 3 key periods to consider optimizing. And of course, if at all possible, trying to avoid the disruptors whenever that is possible. And then really focusing on these fermentable carbohydrates as part of the diet as much as possible in a variety of different sources from weaning onward. And then just keep in mind that it is relatively resilient, so there's lots of room for improvement, recovery. So there's really lots of ways that practitioners can intervene and improve the situation. So I'm going to just show a really quick case example here. So this is for a 3-year-old male who had documented food sensitivities, both just from knowing which foods he seems to be reacting to, but also from testing, both IgG and IgE. So these are the IgE positive results are referred to as potential food allergies, because I think at the time of the testing, that child had not yet been officially tested for food allergies. So IgE testing provides information, but it's not a definitive test for food allergies. But clearly, this patient did have reactivity to foods, both on the test and then also just based on reactions, which included severe skin or rash-like skin reactions, as well as itching. And then on blood testing, he had elevated lymphocytes and eosinophils. So we know there's a few abnormalities on the blood testing too. He was celiac negative, and because this skin rash was so problematic, he was put on steroids. And then once the parents sought out a functional medicine type practitioner, they started off with a gut healing type protocol to support gut health. So this is the GI map results here. Oops, I need to go back there. First page was clear, no current pathogens, that's great. H. pylori was present at a fairly high level here, so that could be having some effects, especially on digestion. We know H. pylori can suppress stomach acid, so it's possible that this patient wasn't getting a full nutrition from the diet, from insufficient stomach acid. Also, we know that stomach acid is important for breaking down proteins. And proteins, of course, are the main potential antigens in the diet. And a key benefit of digestion, of course, is not just nutrients, but also to break up those proteins so that they're not causing problems for the immune system, that the immune system doesn't recognize them as something foreign and then triggers allergies. So that could be a key part of the puzzle for this patient. Now, if we look at the commensals here, you can see there's a general trend to this patient having higher levels, a bit of an overgrowth pattern. We often will see that in some patients that are not digesting so well. So this could be kind of a consequence, for example, of maybe the H. pylori having an effect. At the same time, because that can imbalance pH and other factors in the gut, that can lead to this lower level of Faecalibacterium, or the patient may not have developed their Faecalibacterium along the way as well. So we do want to see this at healthy levels by age 3. And obviously here it's lower than we like to see this. So that could be part of the picture as well. In the opportunistic and overgrowth section, we do see some increases here in Enterococcus, Staphylococcus aureus, and Streptococcus. These are commonly elevated in patients that don't digest very well. And several of them, especially the Staphylococcus, are linked to promoting allergic type conditions. We'll see a couple of the studies related to that in a little bit. So definitely key kind of classic imbalances that we see even in adults who have allergic type conditions. Also, there's one of the inflammatory species, Citrobacter. We talked about those being problematic. This one is overgrown as well. No fungi or yeast, no viruses. Parasites were clear. In the intestinal health section, everything actually looked pretty good except for antigliadin. That was pretty high here, so this patient did have significant gluten reactivity. And I think that was already identified as one of the foods that they had considered removing due to reactivity. But certainly if you see a lot of reactivity like this, that's likely telling us there's some dysbiosis, which we did see. And then oftentimes reduced digestion is part of that picture as well. A quick case summary, there was an overgrowth pattern which suggests reduced digestion. High H. pylori may be one of the contributors by reducing stomach acid. Low Faecalibacterium leads to lower butyrate and then reduced immune tolerance, kind of setting the stage for problems. And then there's elevated opportunists that can promote excessive immune responses, particularly allergies and sensitivities. And of course, the high anti-gliadin, which is confirming that there is at least one type of immune reactivity. So a pretty clear-cut case. We see these sorts of patterns a lot in kids and in adults. So a little bit more about this Faecalibacterium prausnitzii and how do we support it. Kind of simplistically, we use this easy way to remember the 4 Ps. So of course, prebiotics, fibers from foods or supplements can be very helpful. Probiotics, of course, can be helpful. Polyphenols for fruits and vegetables and also supplements may be helpful. Those act synergistically with prebiotics. And there's a growing emphasis now based on research on postbiotics. Primarily now, most practitioners are familiar with butyrate. That's been shown to have some beneficial effects and may be helpful in promoting, in general, promoting the commensal bacteria. There are others that are starting to be recognized. We won't get into any details there, but this postbiotics category can be important as well when patients are missing some of their microbes. Again, we also have these opportunistic bacteria here. So I just want to emphasize Staphylococcus. There's lots of research on Staphylococcus aureus promoting allergic reactions on the skin, particularly eczema or atopic dermatitis, promoting respiratory allergies and asthma, and then in the gut, also promoting problems, including food sensitivities and even IBS type symptoms that are food triggered. So Staph aureus does seem to be a big troublemaker in the gut for adults and for kids. Certainly there's this gut-skin connection, which is probably very relevant for this patient because of the skin rashes, and it can go both directions. So we know in the gut itself, staph can be a problem, but if they have eczema or other conditions where staph is also on the skin, that's known to then indirectly promote issues in the gut. That's partly through the production of this toxin that they mentioned here, the delta toxin, that can trigger activation of immune cells in the skin. Those cells, immune cells, produce cytokines that then travel through the bloodstream to the gut, and then they can activate cells like mast cells and eosinophils in the gut. So that can be one of the key connections here between the gut and the skin for many pediatric patients. Fortunately, we know that for antimicrobials, that's always kind of a key decision as to whether or not to use antimicrobials in children and how to do that. But there are more gentle ways also to shift the microbiome. And of course, probiotics are key. This one is emphasizing research, and there's quite a bit, that lactic acid bacteria, so that's primarily lactobacillus species, can protect against various opportunists like Staphylococcus and Pseudomonas aeruginosa. And those are the 2 most common opportunists we see in patients that have reactions. So probiotics may be very helpful for some patients for sure. All right, so with that, I think we're right about on time here. So I want to turn this over to Greer. Again, we're very fortunate to have Greer with us today. So thank you for joining us, Greer. And I'm going to turn it over to you. So just let me know when to advance the slides.
You got it. Well, thank you, everybody. My name is Greer McGuinness. I'm a registered dietitian. I'm a certified detox specialist and master herbalist. I have a private practice also being a lab consultant for GI Map. I specialize in kids with autism and ADHD, and how I got started real quick is because my son is on the spectrum. So that has catapulted me more into functional medicine than I have ever dreamed in my life. So I'm happy to be here and explain to you guys everything I've learned over the years. I can't tell you how many stool tests and, toxin tests I've seen. That is my specialty, is gut health and toxins in pediatrics. If you give me an adult patient, I'm kind of a fish out of water, but if you give me a pediatric patient, I'm gold. So I have some interesting things to kind of explain to you guys. But I'm going to also try to keep it simple, because with the pediatric gut, there's a couple things I want to quickly go over and explain. Within the first 2 years of life, there is a rapid increase in the microbiome. So it starts possibly as early as in utero. So babies will take on their, mom's microbiome to a certain degree. So we don't think it's as sterile as we once thought. We do know that they do get a lot of microbiome when they go through the vaginal canal and when they are breastfed. But there's a lot of factors that can play in. So one of the crucial things is with a developing microbiome with a child, the first 2 years, every 2 to 3 months, their gut is like a whole new gut. So if you do a stool test on a child who's 3 months, in 6 months, it could be a whole different microbiome. So there are times where you may have to kind of play catch up and do another test more quickly than you would think with an older person, because after the age of 2, it does slow down a little bit, where every 6 months, it could be like a whole new microbiome. So keep that in mind when you're working with littles under 2, that you're kind of working against the clock a little bit as the gut is rapidly developing during that time. So anything, especially when we have children who are going through jumps, brain jumps and things like that around the ages of 18 to 24 months, we have a big brain jump. Around the age of 4 and 14, we have big brain jumps. So anytime I'm working with kiddos, especially kiddos with autism and ADHD, I want to grab them before those big brain jumps, because then you could do the most amount of work to get the most reward when you're working during that population. Next slide, please. So with the phyla of a child looks vastly different than an adult. And as Tom kind of went over, we typically will see children, especially if they are born through vaginal canal and they are breastfed, they will have higher rates of proteobacteria, which is inflammatory bacteria. That is okay, and that is completely normal. So when we're looking at an infant microbiome or a child within the first 6 months, we may see a vast difference in their phyla versus a grown adult. So we need to keep that in mind when we're assessing and not go crazy in a kill phase. I don't like to recommend any kill phases for littles, because this is very normal. This is the way our bodies are supposed to be. And as we develop and as they're, breastfeeding and then weaning into food, it will change. And you can see that in the graph where normal neonatal and 6 months have elevated proteobacteria, and then it does level off by the time they're about 24 months. So between 2 and 3 years of age, their microbiome is more of a mature adult. But before that time, we need to take that into consideration and understand that their gut microbiome is going to be vastly different. Next slide. So there are many factors that can influence anything that happens in the gut. And I work with parents all the time who ask me the number one question: what happened to my child's gut? What caused their gut to look so bad? And it is one of those things that we will likely never know the complete answer to that, because there can be so many vastly different issues. And we know that everybody who has had a C-section's child is not autistic, have ADHD, eczema, or has a chronic health condition. Some of them have been normal and perfectly fine. But we need to actually do a really good history and ask, how is mom's microbiome? Was it a vaginal birth or a C-section? Was it breastfeeding or formula? Were there any antibiotics? Were there any dietary introductions? In the United States, it's still a very old practice to put oatmeal or rice cereal in bottles of babies who are a couple months old, or to start feeding them at 4 months. And we know that that is such an old practice and that the new science doesn't support that. So I have to ask a lot of those in-depth background questions to my families, because to them that's normal, introduction based on what a pediatric, doctor recommended. Are there environmental factors? Are there heavy metals, mold, environmental toxins? us in the States have some of the highest amounts of environmental toxins versus the rest of the world that really do impact the child's microbiome. Are there genetic factors or health and disease issues? You know, did mom have lupus or some type of Hashimoto's during pregnancy or celiac that could be affecting the child's microbiome? And were they getting, you know, enough polyphenols, probiotics, prebiotics, postbiotics? Like, what was mom's diet like, and how is baby advancing in their diet and weaning as well? So a lot of those play a huge role because, let's face it, not everyone has the proper education for how to develop a normal child's microbiome. Next slide. So I really loved this graph. I thought this was really a great way of breaking down different microbe species that might be elevated or low during certain situations, especially if there is vaginal birth versus C-section, formula versus breastfeeding. And you can definitely see that when you are running a GI map, that if these are elevated with your patient, you can kind of go back and then ask those in-depth questions like, wow, I see there's a lot of elevated staphylococcus. Was your child a C-section baby? Maybe there's not enough bifidobacteria. You know, you can ask those questions to get a little bit more in-depth information, and really understand the child's microbiome, that something isn't right. When we have those factors that I had on the previous slide, if they are impacting that child, what does happen is the inflammatory microbiome stays inflamed. So I have kids who are 2, 3, 4 years old, and they are still having tons of overgrowth, tons of, proteobacteria overgrowth, and they are staying in that inflammatory state the whole entire time. Next slide. So when we're trying to assess the microbiome, there can be a lot of variations of what's going on. And I'm sure many of you will get people coming to you because their kids are chronically constipated, or they're having loose stool. And one of the new trends that I've seen recently is I've been getting a lot of people coming to me because their kiddos are having loose stools, chronic loose stools, and the pediatricians are now calling this toddler diarrhea. That is the new term that I've heard multiple times, and it is normal, and they will outgrow it. That's the most common thing that I hear all the time. And but I'm not sure what the point is of gastroenterologists if they're just going to dub it a different term and then move on. But what I like to do is really dive deep. And when I get the GI map back, a lot of the times toddler diarrhea is low stomach acids, H. pylori, or insufficiency of growth of beneficial microbial species. So I can pretty much narrow it down to a few functional pieces of the GI map to say, okay, this is what's going on. Let's just treat that. And 100% of the time I fix quote unquote toddler diarrhea. So it's a scary thing, because if kids are having chronic diarrhea, they're not absorbing their nutrients, they're not getting that healthy fat that they need for their brain development and growth. So something to keep in mind as things like that kind of continue to develop. So I liked this slide, and I found this little graph, and I wanted to add this in for your benefit too, because it will show kind of the different types of overgrowth or commensal phyla that we see. And I see this too in constipation and diarrhea kids. Next slide. So I have a quick case study, and I know Dr. Tom did a great job with his. I wanted to do something a little different because I don't know, I get a lot more kids with eczema, even with comorbidities of autism and ADHD. And I mean, I'm more than happy to ever come back if you guys want to dive more deeper into autism and ADHD. That's like a whole entire separate section. But I figured this might be really helpful because eczema is something that has a multitude layer of factors that could be influencing their system. So I had a 6-year-old female that presented with eczema and rashes. She would have a histamine response sometimes in her face as well, acid reflux. very random episodes of vomiting, almost like a cyclical vomiting syndrome that nobody could figure out why she was just randomly throwing up for no reason. Per the mom, when she did come to me, she was already gluten and dairy free. That was what the mom said. And they did try creams and steroids, and they said they helped a little bit, but she was nervous about using them full term and a lot of the time because of the negative side effects that occurred with what she's heard about them. Next slide. So we did the GI map, and the first thing that we saw was H. pylori. So that didn't surprise me because I kind of suspected with the random vomiting and the acid reflux that she was having that she probably did have some type of digestive insufficiency or H. pylori. So we did definitely see that there. And something with H. pylori, especially with kids, you have to be a little bit on the mend with looking into iron deficiency with kids with H. pylori. So we did send her to get blood work for her iron, and her iron was a little bit low, even though she does eat meat, because H. pylori will deplete iron stores. Next slide. I was actually kind of surprised that her phyla didn't look worse, to be honest. And this happens sometimes where, you know, the mom actually was really good. She's a personal trainer herself. So she eats very well, and so does her kids. So it wasn't like her kids were eating fast food, junk food, candy and sugar. So I wasn't expecting to see anything crazy. But I definitely could see where we have a little bit of issues here, especially that Escherichia spp, which is the fourth one down. Because of the fact that she has the H. pylori and she's not producing a lot of stomach acids, because of that H. pylori, the Escherichia will thrive more in an alkaline environment. So we definitely could see there was a little bit of a pH issue, and we wanted to get a little bit more prebiotic fibers into her diet a little bit. Her Faecalibacterium looked pretty decent, but we always like to make sure it's very robust. Next slide. And there wasn't a ton of overgrowth. And again, sometimes this happens. You kind of scratch your head and say, you know, where are all of this overgrowth that I would expect to find with eczema? We only saw a little bit of strep, which, you know, I contributed to a little bit more of lower stomach acids. But there was a couple other things on the last page that got me more to a better direction of what could be going on. So just because there might not be anything clear cut here, a lot of overgrowth, that doesn't mean that you still can't fix the problem or there are other issues going on. Next slide. So we did find a parasite, which is very common, especially in children. Entamoeba coli and Enteromax nana are some of the two most common parasites that I see in children. And it's just because they're swapping water bottles with one another. They're not the cleanliness. They put things in their mouth. They're chewing on their hands and things like that. So that's definitely something that we were treating because parasites can cause skin issues as well as deplete our nutrient stores. Next slide. So I love the intestinal health marker panel. This is like my go-to for a lot of different things. And one of the first things that I wanted to discuss with mom was the anti-gliadin was a little high. So she was still getting gluten into her system, but the mom, you know, was convinced that everything in the home was gluten-free. But when we went through, we did find some products that had cross-contamination or that were not certified gluten-free, which we removed, which I think did make a difference too. So sometimes even though parents think that they're 100% gluten-free, I do find a lot of the times that it's just not the case. We do miss some things that, you know, has gluten in it or that's cross-contamination. And her zonulin was super high. So she definitely has leaky gut and was causing a lot of inflammation into her system, which I think is what led to a lot of the eczema as well. Next slide. So what I did was we, you know, looked for that gluten, anything that was, you know, not certified gluten-free, and really looked at all of her food products and really focused more on whole foods. We treated the H. pylori with some mastic gum and L-carnosine. We did spore-based probiotics, which also helps with that H. pylori. We did a leaky gut supplement that has L-glutamine, slippery elm, licorice root, aloe. But I want to note that if you do work with kids who are on the spectrum or have ADHD, L-glutamine is not something that you ever want to use for those children because it turns into glutamate, which causes increased hyperactivity. Most kids with autism and ADHD already have elevated glutamate levels, so you never want to give them any type of leaky gut supplement with L-glutamine in it. We treated the parasite with mimosa pudica seed, which is really easy and gentle for kiddos, and some digestive enzymes, and that was super, super helpful. And next slide. And this was her skin within 6 weeks. So it didn't take that long. And her vomiting stopped. She doesn't have any more acid reflux, and her skin has pretty much practically cleared up. And this is also during the winter time, which usually eczema is kind of more the worst when it's in the winter time for kids like this. And so, yeah, so that was pretty incredible that we got those results with just like 6 weeks with just a little bit of support. And it just it goes to show that sometimes the test doesn't have to be terrible in order to provide you with some really grounding information that you can make some big changes just with some simple supplements too. And that's it. So I know we have some questions. I saw that a lot of the chat was going off with some of the questions about supplements and stuff.
Absolutely. So just before we dive into questions, I just want to remind you all, because now we've been diving into the GI map, and I just want to remind you all that we do have an event in Copenhagen the first weekend of November, where we also have Dr. Brady over covering GI map. So just for those of you who want to visit Copenhagen in November, we also have Carrie Jones coming over and she's going to educate on the Dutch test. And yeah, other educators. It's going to be a great 3 days in Copenhagen with focus on lab testing and functional medicine, etc. So moving on to the questions. And I think your last slide actually answered some of the questions in regards to H. pylori.
Yeah.
When do you treat H. pylori and how do you treat it? And you, of course, already mentioned the mastic gum. I already wrote down broccoli sprouts, maybe. We also have something called Metula tea that maybe can, because it's when you're dealing with kids, it's also a question, how do you get the stuff into them? Because you can't just pop pills with all the kids. You have to get tinctures or powders and mix it up. And if you mix it into food, they might get aversity towards the banana if you've mixed it into banana and it has that flavor, etc. So yeah, if you can comment a little bit on that, mainly in regards to the H. pylori, when and first when, and then
Yeah, so it's hard. So kids are notorious for H. pylori. So roughly around like up to about 50% of children can have H. pylori, but only 20% are going to have symptoms. The reason why there's such a vast increase in kids is because of the fact that they put everything in their mouth. They share, if they're in a daycare or a school, how many times have they drank out of somebody else's water bottle or a water fountain? Or if they're kiddos and they're just chewing on things. So H. pylori is pretty prevalent with children. So when I do see it, if it is a problem, if they do have acid reflux, if they're clearing their throat a lot, like, making noises and throat clearing, I will treat them even if it doesn't trigger very high, because I don't want it to be there. I want it to be gone. Mastic gum, L-carnosine, Designs for Health has Gastromend, which has been a beautiful supplement to use. I'm not sure if you guys are able to get that supplement, but if not, you can dose it out, the mastic gum, the L-carnosine. Sulforaphane is great too. The problem with sulforaphane is it's sulfur based, so it's got a very strong broccoli kind of taste, and that can be kind of hard to mask or mix in a smoothie. But I find mastic gum and L-carnosine works super well. And with kiddos, remember, their bodies want to be better and their bodies are going to keep changing every few months. So you don't have to throw the kitchen sink at a kid to get the results like an adult. Sometimes with an adult, you have to give a lot more to get the results you want. For kids, you really don't have to do that.
Greer, one thing I would add on to that, or maybe even kind of punt that question to you, is a lot of practitioners that I talk with seem to also like to incorporate some probiotics with H. pylori. So there are some lactobacillus strains that have been shown in research to potentially inhibit that. Do you find that that's helpful, or is there anything that you like?
Yeah, so I definitely like spore-based probiotics. I've had really great success with just adding spore-based. I find that helps pretty rapidly. But if not, I will do a broad spectrum based, especially if their phyla is really low, if their bifidose and lactose are low. For this patient, her lactose and bifidose were normal, so I didn't really feel a need to add in more of that to kill the H. pylori. So that's why I switched to the spore-based for her, and I think that that's why it worked so well. So I think it also depends on the clinical picture too, especially if their phyla sometimes is just completely depleted.
So I just have a question as well. So we also sometimes the H. pylori is there, but it's not high.
Yeah.
Would you then treat, or would you just, but clearly you might want to treat some dysbiosis with some form of antimicrobials as well. But let's just simplify it and say if the H. pylori is present, but not red and not too high, how would you evaluate such a pattern?
Depending on their symptoms too. And what's nice with like mastic gum and L-carnosine, it is like a little bit of an antimicrobial too. Because a lot of those products also, will help with some of that dysbiosis. So I kind of calling it killing two birds with one supplement. So I don't have, like, if I have the option, if I can get Gastromend, I use that. I'll get rid of the H. pylori if their symptoms and the clinical picture fits that patient, that it could be a problem. I will just use Gastromend or the mastic gum and L-carnosine, even a little DGL, so slippery elm, licorice root, aloe. All of that will definitely help. You don't always have to do a kill phase with antimicrobial. Sometimes that kind of supplement combo really goes a long way.
Good to know. So, but let's say the child does not have H. pylori, but it has some of the dysbiotic bacteria, maybe even in the inflammatory part. Would you then still work with the same remedies for the H. pylori, or would you more go for like grapefruit seed extract drops, or there's this product called bioseeding, which is a combination of different herbs that I know some doctors use, and I use it myself also for children because it's a tincture. It's easy to
Yeah, I like biocidin. I use that too. Pau de Arco is a liquid too, and Pau de Arco is a more gentler microbial tincture, especially for kiddos, like little kiddos. I love Pau de Arco. That works really well, and it doesn't have the same. So biocidin is like a multi tincture, so it has many different things in it. So one of the problems with that is a lot of my patients actually do have a black walnut allergy. So that's probably one of the more common allergies to have in the biocidin product. So if they do, I will use Pau de Arco. I will use grapefruit seed extract in very small micro doses. And like a spore-based probiotic too, which really helps. I really don't ever have to do a big kill phase for my patients unless that inflammatory section is just really, really high.
And just how do you find out if they have a black walnut reaction?
A lot of the times they know about that allergy ahead of time. But if not, when you give them the biocidin, they could have a reaction. So like usually like they get red and hot, they get like hives or your skin irritation. That could definitely be a reason for an allergy.
Okay. Super. Just have to check the chat. I don't think much more came up there. So yeah, I think we'll call it now for it with you and your presentation. It was an excellent presentation. I thoroughly enjoyed it. I love working with kids and seeing kids strive in my practice, and just seeing their bellies getting smaller and seeing their skin condition looking better, etc. So it's a highly appreciated area to hear you present on. And thanks for all the lovely references, Tom. I'm eager to share the slides as well with you all, so you can nerd even more into it at your own leisure, of course. So Tom and Greer, thank you very much. You're welcome to, if you just want to say something at the end before then you can just run off. And as I said, I would hang on with those of you who want to hang on with me. And then I'll do some demonstration in Nordic VMS. We can look for some of the products that Greer has, spoken about.
Well, thank you so much. It's certainly been a pleasure to join you today, and I appreciate you taking some time out of your day to learn more.
And Greer, I might take you up on that autism ADHD presentation. You said it, so we'll put it on.
Yeah, that's like a whole other, that could be like a whole like 3-day spiel, but yeah, that would be fine. I'd be more than happy.
Super. Thank you very much, all of you.
If you do not already have an account with us, please contact our team and we will assist you. If you found this webinar helpful, please like and subscribe to our channel.